y superarte ante la adversidad. En la UISEK somos tu segundo hogar y mantenemos la excelencia académica como la bandera que nos caracteriza, con un ambiente cálido y humano pensando en ti. Permanezcamos unidos y seamos fuertes en el camino. Cuenta con nosotros para mejorar tu futuro. Universidad Internacional SEK, personalización en serio.
Good evening, boa noite. SEK International University is pleased to welcome you to the event Government Strategies Against COVID, organized by the Faculty of Natural and Environmental Sciences and the Office for International Relations. We appreciate the collaboration of our partner, Universidade de Santa Cruz do Sul, UNISC from Brazil. We invite you to write us your questions through the YouTube channel, so they will be answered by the speakers at the end of the event. I have the pleasure to present Joana Medrano, our Dean of the Faculty of Natural and Environmental Sciences, who will give us the welcoming words. Thank you, Joana.
Thank you, Karen, for the introduction. The COVID-19 pandemic has tested our world at every single aspect in the last 6 months and continue to the present. The global spread of the virus have overwhelmed and collapsed every single health system in the world, and it has brought with it social and economic disruptions. Governments from all over the countries have taken some strategies to measure, safeguard people's life and to prevent the spread of the COVID. However, we already know that any strategy for this government and for the society needs to be attended, needs to be carefully planning, and with commitment, it will have some positive response to this pandemic. In this case, the Natural and Environmental Science of the Universidad Internacional SEK, we would like to welcome our audience and thanks to the speaker for this webinar. Welcome, everybody.
Thank you very much, Joana. Right now, we have the important participation of Bruno de Souza. He is assistant professor of the International Relations course at Universidade de Santa Cruz do Sul, UNISC, since 2012. Meldensky is a PhD student in international relations, holds a master's degree in international relations and a degree in international relations. And also our professor, Jose Salazar, he is a professor at SEK International University, is PhD candidate in geography at the University of Cantabria, and has a master in socio-environmental studies. Welcome, Bruno. Welcome, Jose.
Thank you very much. Good evening to all. It's my pleasure to be here in this webinar together with the friends of UISEK from Ecuador. Thank you very much, Cristiana and Karen, for organizing this event. Thank you for the invitation. I also want to greet my colleague, Professor Jose Salazar, also Professor Johanna, and Professor Jose Ruben. So we will talk about the coronavirus, and this is a reality that we are all living, at least for 3 months. But the questions that will guide my presentation is why Brazil is on the 2nd place on the number of the deaths on coronavirus. So in this sense, I divide my presentation in 3 broader topics. First, I want to talk about the Brazilian approach to coronavirus. Second, I will talk about the problem of the politicization of the pandemic. And at the end, I want to talk about the global perspectives of the pandemic. So starting with these questions, why Brazil are going so bad in combating the pandemic, we can appoint some issues that will help us to try to understand this phenomenon. First, the first issue that's important to think is that Brazil, as a huge country, as a continent, but in this moment lacks of a nice and compromising federal government response, because the federal government of Brazil don't show the leadership and the trust necessary to inspiring all the people and also guide the local governments to adopt the safest and important measures against the coronavirus. So I think this is the one point that's very important. And also we can make some comparisons with United States, that it's sadly the #1 in the cases and the deaths, and also has, in my view, a problematic presidential leadership that sometimes confuses the people towards what is necessary to combat the coronavirus. So also another issue that's very important, it's that unfortunately here in Brazil, people are not committed with this social isolation. Don't matter if you have a nice political government, you have a nice health system, and people individually don't make this part, don't stay at home, and don't use these health measures. So this is the second important thing in this area. People need to do their part in this crisis. Also, another problem that we see here in Brazil, and I look forward to heard my colleague, Professor José Salazar, about the situation in Ecuador. But here in Brazil, we have the problem of the communication. And in my opinion, this is not a problem with this crisis of coronavirus. It's a problem of the nowadays time. So what I'm trying to say, that people not trust anymore on the news, on the mainstream media. People turn on the TV and sometimes know that the people are not telling the truth or the whole truth. And okay, this is a problem, but what people now are doing, they are searching for the news on the not traditional media. What it's not problem in first instance. But if you look for information on WhatsApp, Facebook, Twitter, and so on, what's the journalist control of this information? And also, we can tell about what happens nearly 2 years ago here in Brazil during the presidential election. That's a huge campaign of fake news started on WhatsApp. So we have this situation, because if you turn on the TV, media only talk about deaths, and the problems. That of course it's important, but we have to agree they overreacted on this. But on the other hand, if you try to see other kinds of information, especially on social media, you have no control. And people sadly believe in all these conspiracy theories. That's another issue that brings me to my second point, that is the politicizations of the pandemic. It's really bad. It's really, really bad, because I can talk about my country. What we see here in Brazil, that the major politics only cares about their personal gains, their personal visibility. The country is not united against the virus. I think the federal government missed a very nice opportunity to unite the country that is divided since the impeachment of the former president Dilma Rousseff. The country are divided in left and right, and the current government should take the opportunity, but this crisis, to unite the country against a real problem, a real enemy, that is the virus. But we know, or at least we should know, that we only can win this battle with science, not with conspiracy theories. So in this sense, we have seen here in Brazil a lot of accusations that sorry if I'm laughing because it's what we can do. The virus, it's a Chinese conspiracy together with the direction of World Health Organization, leader by a Ethiopian communist, and all these things. But the problems, as I mentioned before, in social media, that this information have no control. And people, especially the older people, see this, should be true, and pass. So it's a very problematic situation here in Brazil because, as I told you before, people don't trust on television because we know that they have their own interest in, and sometimes they exaggerate some points of the news. But also we have this dark side, this dark area of the internet, which have no control, and also came to a point that the current president of Brazil eventually, as the president Donald Trump, have some posts erased, deleted by Facebook and Twitter because they are spread fake news, false information. So this point is really, really problematic. Also, this is one issue in this part of the politicization of the pandemic, the fake news and the communist threat. The second point that I want to talk with you is that if there is a dilemma, and this is very, very, very discussed every day, at least 3 months here in Brazil, there is a dilemma between you save the life, you try to make people stay at home, not spread the virus, or but if you do that, you are killing the economy. So the government tried to put this dilemma, especially the federal government says that we cannot crush the Brazilian economy with this social isolation measures. But the point is that as past 3 months, we see that the cases are increasing, people are getting sick, people are dying, but in the other hand, the economy still are going down. So I believe, as a lot of specialists, that what the government should do is, okay, people have to stay at home, but we, as the government, as the entity that grants your money from taxes, here in Brazil, the taxes are really, really big, especially if you are not rich people. So we will give this financial compensatory. We will try to equiparate your personal loss, your firm and company loss with these supports. And in this sense, create a nice and safety atmosphere, forcing the people to stay at home. But sadly, that we're not seeing this issue. What we are seeing, and it came to my last point of this topic, is that we have these political fights between the local governments and the federal government. What I'm trying to say, the Ministry of Health say one thing, but the local government don't follow this, and the Supreme Court says another things. And when the regular people stops and thinking what I should do, who I supposed to follow, the federal government, my local government, the international organizations like the World Health Organizations, or the Supreme Court. So this is a really problem because people lack of confidence in politicians, and also these politicians are politicizing the pandemic, try to make their own personal gains above the well-being of the rest of the people. So this is a really sad situation. Also came to my first topic about the Brazilian approach to the coronavirus. one thing that this pandemic teaches us is that sadly the virus and the disease always attack first the most vulnerable and poor people. As we talking before with our colleagues from Ecuador, from UISEK, Brazil indeed has a nice and advanced medical resource. Brazilian medicine is very well appreciated in all the world. Brazil has some of the most notable scientists and hospitals. But still people are dying. But why? Because normally if you see the map, on the parts of the people get most problem is that part when health are not universalized. It's not for all the people. Indeed, here in Brazil, we have a wonderful system. In Portuguese, we call it SUS, Sistema Único de Saúde. That means that health, universal care should be to everyone. But sadly, it's not the truth. So if you see the numbers, you see the data, we will see that the people that are dying mostly are poor people that cannot go to a private hospital because the public are all crowded. So that's a huge problem. And also we can make some comparisons with the United States because contrary of Brazil, United States don't have a universal health system. So it's not, in my opinion, by accident. They have the biggest numbers of people attacked with the disease and people dying. Well, so until now, and I don't want to be tired of all of you, we talk about the Brazilian approach to the coronavirus. We talk about the problem of the politizations of the pandemic. And also to close my presentation, I want to talk about the global perspectives on the coronavirus. Because what we see now is the rise of the World Health Organization. That I'm sure that, I don't know, 1 year ago, most of people in the world even know that existed. But has doing a wonderful job, try to inform people, try to create some guidelines to be used for the government. But as the issue is politics, as every important things in the life of the society, in the world is the same, we see that the World Health Organization is being politicized, is being used for the politicians. Especially, they became a field in the global, I'll not say war, but the global dispute between United States and China. Each one tried to accuse the other as not responsible, but guilty for what's happened now, and including the World Health Organization being accused to be a communist. Really, in this year, but that's all happened. Also, we can see in the global perspective that this crisis, it's another external factor that weakening the multilateral efforts of European Union. As we see in the Euro crisis and the refugee crisis, European Union not be able to create a joint strategy to combat the virus. That is really complicated. And another issue is that, and for this I'm very anxious for the questions of the audience, it's how the world see Brazil. And I'm not so sure that the world see Brazil in a positive way regarding this pandemic. But these questions I will give to the audience. So finishing this first part of my presentation, my conclusion is where we will go. How will be the life after the pandemics? One thing that I believe that will happen, people will be more careful with their health, using masks, alcohol and gel, and all these important measures to to combat this disease. And I want to finish with this idea, and I hope, and I really truly hope that this pandemic after ends don't make people separated from each other, because now it's really important that we stay at the home, that we not stay together physically, but we have to use all the technology as we're using now to communicate it, to get more close, to get together. But I really hope with the end of this pandemic, people are more united and not separated. Thank you very much.
Thank you very much, Bruno. Now we have our speaker, Jose Salazar.
Thank you, Karen. Thank you, Bruno, for the presentation. Very good. Thank you, all the people that are here. Let me give me a minute to put my presentation in the screen. Okay. Okay, I'm going to start my presentation. First, welcome everybody. Thank you to be here. We are so glad that you share these few moments to see this important topic and talk about a little bit about it. Okay, we are going to talk about I'm going to talk about the COVID-19, the case of Ecuador. The things we are going to talk in we are going to talk in this presentation are going to be how can we describe Ecuador efforts to contain the pandemic, the dilemma of life preservation versus economy, is it real, the politicization of the pandemic, a local and regional pandemic approach, solution in a context of national Ecuadorian government's lack of action, the COVID-19 economic impact, the difficult measurements of uncertainties, and finally, we are going to talk about the post-COVID-19 life, where we will go in the future. Okay. Okay. What are the efforts to contain the pandemic in Ecuador? To talk about this, first we have to talk about the chronology of the events on how happened COVID-19 in these few months. The first case of COVID-19 was reported February 29th by the former Minister of Public Health, Catalina Andramuño, in Guayaquil. That the first reported case of COVID-19. Probably there were more cases, but this was the first case. Okay, in March, we can say that was the spreading of COVID-19 in Ecuador. Every day we have reports of new cases in Ecuador. And for that reason, like the authorities, approximately between the 15th of March, decide to take measures to control the disease. Some of the measures were implemented a quarantine and closed the airports in all the country. In April, we have a biggest wave of COVID-19, especially in Guayas province and in Guayaquil city. Some data emerged in April 17 suggested that the number of deaths due to COVID-19 may be much higher than the official reported. Some reports say that the number of deaths in that period of time, in between the 6 weeks, the start of March, was 10,000, approximately 10,000 people died. That number exceeds more than 6,000 deaths, the average normal deaths in that period of time. that bring us an imagine of how huge was the impact of COVID-19 in Ecuador in that period of time, and especially in Guayaquil. The next 2 months, we can call them the new reality. Why the new reality? This month, the new reality was a slogan that is used by the government to refer to all the measures that government want to implement to reopen the economy and reopen the activities. The economy of Ecuador was in really bad shape until COVID-19, but with COVID-19 was totally destroyed the economy. And for that reason, it was a huge pressure especially by big business to reopen the economy. And this pressure was here by the government, and government decided to take measures to reopen the economy, to reopen business. In this context, Ecuador probably was the most affected country in the world by COVID-19. In this picture, we can show that you can see is our report from Financial Times, and you can see the total exceeds deaths per million people, and Ecuador is in the first place over other countries like Spain, UK, US, and Brazil too. Okay, and the most affected region in Ecuador and in the world by COVID-19 probably is Guayas, Ecuador, where is Guayaquil, that is the second biggest city in Ecuador. Yeah, for that reason, the measures that the government implement are not too effective, something that we are going to see in the next slides. Yeah, as I say earlier, the measures that the government implemented were totally inefficient and not effective to control the disease. One of the reasons that these measures are not effective are the government don't implement the enough number of tests to control the disease. In example, this is the number of tests that the government is implementing now. The number is 130,000 tests, but there is a number of tests that don't have results yet. This number is 30,000 results that don't have results yet, of tests that don't have results yet. Another reason that the control, the measures taken by the government are not effective is the control of two measures that implemented the government, quarantine and the system of traffic lights, are not too effective. For example, in Ecuador, we have 1.9 million cars, but the government give 4.7 million of safe passage to these cars to increase the mobility of people. For that reason, the restrictions of traffic are not too effective because there are exits of safe passage of cars in the streets and the people. Another thing that happened is that government implement new laws and new measures, economic measures especially. These economic measures and laws create more social conflict because they decrease these laws affect rights, especially labor and social rights, and that creates that people make angry and protest against these laws and these measures. Another thing is that the big business increase pressure to reopen the economy, something that was against some measures that want to implement local governments, and things that was implemented by the national government. Other bad thing is that Ecuador don't have a good system of statistics to implement measures against COVID-19. That's something that doesn't help to take measures to combat the COVID-19. And finally, we have a very bad system of communication, especially in this topic of COVID-19. Many authorities have contradictory speeches, and these contradictory speeches creates confusion in the general public. That's something that creates more and more confusion, and people don't know what to follow and what are the rules that they have to follow. There are the measures that they keep, and there are the things that don't generate enough efficiency to control the pandemic here in Ecuador. Now, we have, like Bruno said, we have a dilemma between life preservation and economy. In Ecuador, we have this dilemma, and this dilemma creates the conflicts between social actors. For example, national government versus regional and local governments. National governments is with the theory of open the economy. They want to open the economy. They want to take measures, biosecurity measures to control the disease, but we have to open the economy. For example, in this tweet that was written by Maria Paula Romo, that is the Minister of Government in Ecuador, she said, this week begins July. More than 100 days have passed since the beginning of the emergency, but we cannot neglect ourselves. Tomorrow we will meet with the mayor and the Minister of Health to review the situation in Quito and from the approved new rules of the street lights. That is the system that we manage here in Ecuador to control mobility and business. Okay, there will be no municipal or government measures that is sufficient if it is not accompanied by individual and community responsibility. In Quito, the areas of greatest contagion coincide with those of the most cases of no compliance with the rules. Look at the facts. In this tweet, she tried to say that we have the problem is that people don't follow the rules, don't follow the restrictions, social distance, don't wear masks or things like that. But it's not a problem of the government. The government is doing its best, but the people don't help, or is not helping themselves. Okay. In the other hand, we have words like, or people like the mayor of Quito, Jorge Yunda, that say things like this. Unfortunately, we are not understanding the serious danger to which we are exposed as city. The health system, the health service are no longer effective. Decisions will have to be evaluated no matter how hard they are. In this tweet, the mayor insinuates that we have to take stronger measures to control mobility and business and to restrict mobility, especially. Something that contradicts what the government want to do. Another conflict that we have is between big business and doctors. This tweet is from Patricio Alarcón, that is the president of the Chamber of Commerce of Quito. In this tweet, he said, what is responsible to equip the convention center that is a temporal hospital to implement the municipality of Quito? Well, and that a municipality control as sensitive areas, There are management flows Let's worry about health and that people have jobs to survive. We have to act, empower people and not fill them with fear. Okay, big business have this speech that we have to take measures, wash our hands, wear masks, and we are free of the virus, and we have to save the economy first. That's a speech that contradicts, for example, what a doctor says. This tweet is from Ricardo Hidalgo Tolengui, that is a rector of a big university here in Quito, and he also is a medical doctor. In this tweet, he said that the situation in Quito is too critical now. It is not prudent to allow around 90,000 public employees to return to face-to-face work. There are 1,500 patients on the waiting list to enter an intense care unit. In these both tweets, we can see that there are contradictory speeches that don't allow people and actors work together. We have two different visions on how to manage the COVID-19. One that prefer or give preference to preserve economy, another that give preference to preserve life. In my opinion, I believe that both have to go together. We have to preserve economy and preserve life. Both have to be in the same way. But in these speeches, we are in totally contradiction. Okay, now in the economy impact of COVID-19. Some of the data that I got of economy of what are the risks that put COVID-19 in the economy. For example, in employment, there is about 700,000 jobs that are in risk to be lost by COVID-19. The sectors that are more in risk are commerce, industry, and agriculture. This brings us a picture of how huge is the impact of the COVID-19 in the economy. For example, another thing, we can see the impact in the GDP of the COVID-19. Some projections say that the impact of COVID-19 in the economy is going to be between minus 7.2% and minus 9.5%. And other projections say that it could be worse, minus 12%. This number brings us an idea of how huge is the impact in the economy and how affected is Ecuador in its economy. For example, in conclusion, this is a news article of one of the biggest newspaper in Ecuador. It says that only May, the loss in economic and in sales is about $40,000 million. That you can see if you can put in terms of GDP, it's around 40% of GDP. Now, in the last part of this lecture, we are going to talk about what is going to be the life post-COVID-19. And we have here a question: where will we go in the future? And the answer that we have for this question is, I don't know, really. There are too many uncertainties that we have to manage, and we don't know, and we can project a project something to see what will happen in the future. For example, there are two things that will change for sure in the future. One is work, and the other is study. For example, in work, something that have been well promoted in these few months are teleworking. For example, teleworking is a new way of work. Yeah, people are working in home, doing things that normally they did in office, but now they are working more in home. And some people say that affects the rights of the workers, because most of the time they don't have the freedom to have free time. For example, they are working 24 hours, 7 days per week. And they are totally controlled by work and by bosses. For that reason, that's one of the things that we have to think and to regulate in the future. Probably we have to create new laws to regulate teleworking and make more and create more stability in this kind of working for workers. Another thing that changed, like I said, is studies. For example, homeschooling is a new modality of study, especially for kids that couldn't go to schools in normal way. In this modality, for example, Ecuador doesn't have a good law or regulations to control this kind of study, and we have to generate new legislation to control it. Yeah, these only are two examples of the things that how life will change in the future, and we have to think about how to regulate and how to control it. Oh, okay, that's all we have now. I hope that you enjoy this presentation. Thank you, everybody. We will have a round of questions in a few moments. Thank you, bye.
Thank you very much, Jose. Right now we're going to have the final presentation for Bruno. So thank you, Bruno. Bruno, we are sorry, we didn't hear you.
Your microphone.
Okay, sorry. I was saying that was very interesting to hear the professor Jose Salazar, because I can identify very points of convergence and a lot of points in common between this problem of the coronavirus in Ecuador and also in Brazil. And I believe that in certain ways there's a global problems, like the issue of we don't have tests for everyone, the problem how you can control people at home. People should stay at home. Of course, it's true, but what's the limit that you can go to and find some people that are on the streets? It's very complicated, especially in big and broad places like Brazil. Also, Professor Jose Salazar bring another very interesting questions that indeed happens in Brazil. That's the problem of the communication of the politicians, especially regarding the central government toward the local government. And people really don't know what to do, who wants to follow, who needs to follow. And then I want to bring another question that to me fits in this point. that I don't know in Ecuador, but I can share in Brazil, that's the lack of a real good leadership, the lack of studies, the statesman, sorry, the lack of statesmen that we have here, the lack of the politicians that put their own interest in, not in the first place, and think first in the country, in the well-being of the community. And I think that this crisis expose this problem in Brazil, and also in terms of international relations. That's my area. Sadly, we cannot see efficient global response to coronavirus. In this moment of crisis, every government just close their border and try to think as they want, their own problem, not globally. So it's I think thinking in a broader perspective, in theoretical perspective, it's really bad for the international order, this crisis, because shows that at least as we see now, at the end of the day, the people and the countries only think about themselves.
Okay. So,
Okay. Okay, thank you very much, Bruno, for your interest. Thank you very much, Bruno, for your interesting presentation. We can hear you, Jose, so we don't know if to finish or something, but right now we are going to have the round of questions that Jose Ruben Ramirez, a research professor at the Faculty of Natural and Environmental Sciences, will ask. So thank you very much, Jose Ruben.
Thank you, Karen. Okay, thank you, Karen. Thank you, Bruno. Thank you, Jose, our speakers tonight. And we have the following questions. The first one is for Bruno, and it's a very controversial question. What should governments prioritize, health or the economy? Talking about maybe the Brazilian context.
Yes, indeed, it's a very polemic, but also I'm very happy that you asked this question. It's a very important question because, in my opinion, this issue of the economic and the life preservation is at the center of these discussions on the virus. So, the funny thing is that if you look at the first glance, it's like obvious. You have to preserve the life, of course, but you cannot close the eyes from the economy, because after this crisis passes, people need to get normally at their jobs. So in my opinion, especially talk about Brazilian case, the problem is that the government, because if you see this crisis begin in the beginning of the year, January, in China, February, go to Europe, then only in March comes to Brazil. What I'm trying to say that Brazilian government have time to watch what's happened in the abroad and think in a strategy that can bring together the life preservation and the economic preservation. Because as Professor Jose Salazar well say, the impacts of economics will be huge. He's talking about like 9-8% down of the GDP of Ecuador. And you can do both together, preserve the life. But to do that also, it's a political choice. It's a very important political choice. So if you do that, you have to abandon the liberal idea that state cannot intervene in economics and try to make public investments on economic, as I don't know in Ecuador, but in Brazil, the government is giving, I think since 2 months ago, some, how can I say, the economic support for the most poor people, like the half of the minimum wage. So I think the government should spend, that's the time to the government should spend money to try to not damage so much the economy. But I am sure that if you ask these questions to a person that has some different economic and political view of my own, he will receive the different response.
Okay. The next one, the next question is for Jose. How the world sees Ecuador, talking about this context of management and political strategies against COVID-19, Jose? How do you think, what's your opinion about the world see our country?
Personally, I believe that Ecuador is not the best example in the world to combat the COVID-19 and to manage the pandemic. Yeah, we have many problems. Yeah, too many problems. And as we see in the presentation, we are the country most affected by the COVID-19. We have the biggest number of diseases around the world if you compare with the number of people in the country. Yeah, we are the most affected country. I believe that we are the worst example that to manage the COVID-19, and probably in the future cases like Guayaquil we are going to study, but for the very bad managed that was made. Yeah.
Okay, thank you, Jose. The next question is for Bruno. Bruno, what's your opinion about the position or disbelief of citizens towards the government in this context, in the pandemic context?
Well, it's a very interesting question because, in my opinion, what we have here in Brazil, this distrust of democracy and distrust of the government. People in regular base don't trust the government. People in regular base don't trust the state. That's really complicated because in this situation, as I say before, people don't trust the government, people don't trust the mainstream media, and start to catch the information on the alternative media. And of course, I always support the alternative media because I know, especially in my country, that traditional media, it's always connected with the interest of the rich people. It's historical in Brazil, and I think in Latin America, sadly. The media always support the interest of the rich people. That's for true. But sadly, we have this problem with the internet and the lack of control. But trying to respond your question, I think there's a crisis, that's a crisis of, I find the word, there's a crisis of representativity. People don't see themselves on the government. But what's the problem? That it's very easy to point the finger to the government. The government is wrong. They only think about themselves. They are corrupt. True. But in my country, the government is the mirror of the society. If you put random people on the government, sadly, these people will do the same thing. So we have I think, in my opinion, we have a crisis of the state. You have a crisis of democracy in Brazil because people not trust in the government, also don't trust in each other. I don't want to sound very pessimist, but it's what I believe.
Thank you very much. Right now we have the...
Thank you, Bruno. Okay.
Thank you very much. I'm sorry, we have some internet issues here. Right now we have the conclusion. Jose Ruben, please, if you can help us with that. Thank you.
Okay. Thank you, Karen. Well, first, I would like to extend a huge thanks to our speakers, Professor Jose Gabriel Salazar, Professor Bruno Medensky, for this exceptional presentation tonight. And well, I think this is important to highlight that whatever the measures taken by the government, by politicians, by leaders of every country, all the efforts should be focused to help people, to help all the vulnerable sectors, to help the citizens, to try to stay calm related to the situation of the pandemic. We must consider the context of every citizen, those people who can no longer wait in their houses, but also consider that without the contribution of everyone and the responsibility of each of us, things may be even worse, even difficult. And now maybe this pandemic will eventually end or come to an end. We hope, every one of us hopes so, but I think it's also important that the responsibility is in our hands as citizens for each country. Again, thank you very much to our speakers, and I hope that this session tonight is very, very profitable for every one of us. Thank you very much and goodbye.
Thank you very much, Ruben, for your important conclusion in this important event. UISEK International University and the Universidade de Santa Cruz do Sul, UNISC, appreciate your presence in this virtual event. We invite you to review the academic offer of the Faculty of Natural and Environmental Sciences of UISEK International University on our social networks and website. Good evening, boa noite.
En los momentos de crisis, tu educación es una oportunidad para crecer, para brillar y superarte ante la adversidad. En la UISEK somos tu segundo hogar y mantenemos la excelencia académica como la bandera que nos caracteriza con un ambiente cálido y humano pensando en ti. Permanezcamos unidos y seamos fuertes en el camino. Cuenta con nosotros para mejorar tu futuro. Universidad Internacional UISEK, personalización en serio.